So we'll go ahead and get this started. This will go as long as you guys have questions, basically. This can go really, really fast, or you guys can drag this out, whatever you want to do.
We're time to go home.
Okay, sounds good. We're done. Emergency? No, I'm just kidding. So basically, I want to go over, share some things with you guys about the things that most likely we will see just because the age of our congregation, the more people that are here. We can't cover everything. We can't talk about everything. So these are kind of some things that when I was asked to do this, these were the things that jumped to my mind off the bat. Okay? So we'll talk about a few things, give you guys some things to look for in regards to a heart attack, in regards to a stroke. Even some things to look for anaphylaxis. That's one of the things, especially when we're feeding people. And then even signs and symptoms for things like a diabetic emergency, which especially a lot of kids nowadays are starting to be diabetics. And so they experience these emergencies more times than you think. So just some things to watch out for. Be some things we kind of talk about real quick. And then also we'll talk about how to kind of care for them, especially in the moments when the emergency first happens. We'll talk about AED stuff and pretty much answer any questions at that point. So, we'll jump right to this. Because of the age of our congregation, heart attacks are more likely to occur, especially when we're walking from the parking lot into the building. Basically, the idea here is some things to look for. Your Hollywood style, stand up, grab your chest, fall over, really doesn't happen. It does, but that's not what you're going to see, okay? You're going to see the person who I saw a couple weeks ago walking in the breezeway, and when I kind of introduced myself and what are you looking for, and did you get a chair? I mean, it was kind of, that's a little nervous. That's a little nerve-wracking. It's these things like chest pain or discomfort. A lot of people are going to drink Mike's coffee and be like, man, that may be something to kind of pay attention to. Okay? If they have the chest pain discomfort for no reason whatsoever and they haven't been around Mike, then you might want to be a little more cautious about it. Feeling weak, lightheaded, or fainting, especially some of the older individuals who are walking from the parking lot into the church, and they get in that breezeway, and they're kind of holding the wall thing, you might want to take a note of that and just kind of be with them, stand with them. Notice that kind of stuff. The classic signs of pain or discomfort in one arm, both arms, or the shoulders. It's kind of weird. Your heart's way down here, but your shoulders hurt. You can start getting some pain, neck, jaw, down the arm. But those are your textbook perfect classic signs. I'll tell you now, females are completely different. They have a heart attack and don't even know what happened. And those are things, I don't feel very good. I just maybe a little nauseous. And those are the ones who are like, yeah, you could be having a heart attack technically. Okay. The shortness of breath, just the pain, things like that. They're breathing faster. And you guys will see this in Sunday school class. If they come to Sunday school class and they're just panting like a dog, and you're like, you okay? Yeah, I just walked in from the car, or I just... Pay attention to that kind of stuff. Those are little things that you can see from across the room that may be able to give you an inclination something's fixing to happen. The excessive sweating, and I'm saying not Texas sweat from walking in, but like they're just sitting there and you can see it on their shirts. And you'll, when I say excessive sweat, you will know excessive sweating. You're going to look at them and go, you just get done running a marathon? Nope, been sitting here for 30 minutes. Really? Okay. And you get nausea. You know, with a heart pain, heart problems, it causes some nausea, discomfort, feel like they're going to vomit. Those are some signs that kind of get you to start thinking there's something going on. There's something happening. Like I said, your Hollywood style is very, very rare. And here's another thing that I've noticed when I was working as a paramedic is the older individuals, especially females, don't want to be a burden to anybody. So they will sit there and they will sweat. Oh, it's hot. You know, You okay? Yeah, everything's fine. Really? I mean, so you may have to kind of push a little bit in things. They just don't want to be a burden. They don't want to be a nuisance. They don't want to cause any problems. So when you're able to see some of this stuff, those are red flags to you that something is concerning. So your next one is your strokes. These are going to be things that you guys are going to notice in Sunday school, for example. Especially if you have a group that likes to talk. When somebody sits down and starts to slur their words or look funny or sound funny, or you guys can catch these things. Sudden numbness and weakness in the face, arms, legs, you're not going to know that. But when they say something and they slur their words, and you say that again, and you watch them talk and one side of the mouth isn't moving. That's something to kind of be concerned about. Confusion. I know sometimes older people can... Okay, so, anyways,
Hey.
No. I forgot what I was saying. No, but confusion. Just really kind of a strange, unusual confusion. Trouble speaking, difficulty understanding the speech. And again, you're not going to see this. Trouble seeing in one eye. They're going to, they'll make a sign to you that something's, you don't do that every Sunday. You don't talk that way. You don't look that way. Obviously, trouble walking, dizziness, loss of balance. And here's the thing that Mike spoke of this morning of the lady who ended up going to the hospital and things, the severe headache with no known cause. They will have, and this is the big thing, is what happens is somebody, again, with the age of the congregation, of the majority of the people that come in are older and things, they have these beautiful little dogs that they love to death that they trip over. They will never admit they tripped over the dog. Because what are we going to tell them as the children of our parents? Well, get rid of the dog. No, that's their companion. So they won't admit it, but they fall Saturday night. They go to sleep. Oh, no big deal. Get up, come to church, and they're kind of looking, you don't seem right. You seem off. They can have this brain bleed where I just got a headache, and I don't really feel well, and the more you talk to them, you come to find out they fell the night before, went to sleep, and so these severe headaches are pretty good signs something's up. This is what's called a TIA, and this is basically a stroke that happens, and it's kind of freaky. You could be talking here to Joe, and you could watch his face paralysis. You could watch him droopiness, and then as you're talking to him, you say, "Okay, say this after me," and you give him a sentence to say, and halfway through the sentence, it all goes away. It's like, that was weird. Okay, whatever, and you go about your business. That's a stroke that happens when the clock gets stuck and basically dislodges and moves on. And so that disruption of mental capabilities, for example, gets diminished and then restores itself. It's still a stroke, okay? And so if you see something like this, and as you're talking to them in a situation, and you notice something, and as 10 minutes later it kind of goes away, 4 minutes later it goes away, you might want to, hey, you should probably get checked. Right? Just saying. Put that out there. Because if it happens once, it's going to happen again. If that clot gets through the brain, it's got to go through the body, and it can get stuck in the heart, there's your heart attack, when you're stuck in your lungs, and that's where your PEs, your breathing problems are at. So if somebody says, "Oh yeah, I'm fine, it happened, an hour ago," you want to go get checked out. Anaphylactic reaction. I put this in here, number one, because at our former church we had some kids who were allergic to ants. And we were playing in the yard the other day with balloons and stuff, and I started jumping around like a little child. I was getting bitten and all that stuff. And then also, with food that we're cooking food. So in the event that for some reason somebody has some reaction to it, just some things to watch for. Skin reactions, nausea, vomiting, diarrhea. Obviously the big things, constriction of the airway, swollen tongues, wheezing, trouble breathing, abnormal breathing. Breathing should be effortless and quietless. Nobody in here can tell nobody's struggling to breathe, you'll know when somebody's having a problem because it doesn't look like this. It's going to be labored, you're going to hear it. Weak rapid pulse, this is where my wife comes in. Weak rapid pulse, her blood pressure drops, she gets dizziness, she faints. So these are things again, just little things to watch for, to notice that you may see. And then here's the last one, the diabetic emergency. Chances are if we had anybody who had a diabetic emergency, chances are it's because their blood sugars are low. Alright, so what's going to happen is they get kind of tired, drowsy, maybe start getting confused again. Shaking, trembling, some of them, I don't know why, they just start to tremor. Again, the profuse sweating, clammy skin. When I talk about clammy skin, I'm talking like sticky, it's almost stickiness. You got sweating that's wet, and then you got the sweat that's kind of somewhat dry, and it's tacky.
It's cold.
And cold, yeah, cold clammy skin. So if you touch them, hey, how you doing? And you realize, that was kind of gross. There's your clammy skin. Excessive thirst or hunger, usually that's with your high blood sugars. They're just excessively thirsty. They just can't get enough. There's some numbness, you won't know, they'll tell you that. They're feeling dizzy. They will sit and talk to you, and then they won't talk to you anymore. It's very quick. But here's the one that's interesting, is they may appear drunk, irritating, combative. They're confused. They have no idea what's going on, and you're trying to help, and they'll swing at you. I mean, they'll come after you. Okay, so again, it's that unusual behavior. Something's off. Something not right. Just again, things to notice for and stuff. Here's the way we're going to kind of look at it and treat it wise. Very simple. Very simple. For the heart attack, the first thing you do is call 911. Okay, pretty simple. You're going to support care. There is nothing you can do. There's nothing as a paramedic we can do. Really, they need a cath lab. Is what they need. I can relieve some of the symptoms on the ambulance, but I can't stop it. Right? So supportive care, if they go unresponsive, you're going to kind of initiate some CPR we're going to talk about. And then of course using the AED. But if you start noticing somebody's kind of feeling dizzy and man, I don't feel well. Just send somebody to go get the AED. Start making those moves then. Don't wait for them to be like, I just don't and fall over. That doesn't happen. Okay? That's not how it works. So again, you're stroke, guess what? Call 911. Now here's the thing though. We laugh about it, older people get confused, whatever. There's some things you can kind of ask some questions as somebody's calling 911. You can notice their face, like I'm telling you, like the mouth will droop, it'll hide down. And you can say, hey, smile for me. And one side will smile, one side won't. That tells you right there something's up. You could do their arms, you're like, oh, well, how you doing, and how you doing? And kind of hold the arms up and go, well, I was just thinking, and watch the arm, it'll fall. It'll slowly fall. It'll fall. Speech, again, if they're saying stuff, slurring words, hey, what was Mike talking about today? And just kind of have them reiterate and you'll know when you start to see the slurs and they can't make complete connections, their mouth isn't moving correctly. Time, this is the biggest thing. When were they seen normal last? If they came to Sunday school at 9:30 and at 9:45 they started acting funny, they're going to want to know what kind of time frame, because there's a certain window of treatment opportunities. And so knowing when it started gives them a lot of clues as to what they're going to do next. So that's a big thing to pay attention to. And if they come in, I just haven't been feeling good. I've had this really bad headache since yesterday at noon, and things just aren't connecting, and they're not making dots. And that'll be your last time normal. Will be noon. Well, at that point, they're out of the window for almost any treatments whatsoever. All right. So time is very, very important for these strokes. Let's see here, and then your anaphylaxis, obviously, first thing, 1. And then treat with the EpiPen if that's what they have. If they're really in anaphylaxis, that's the only thing that's going to work, is the Epi. It's called epinephrine. That's the only thing that's going to work for them. Now when they get to the hospital, they may give them some steroids, Benadryl and fluids, but epi is what's going to be what saves their life. And so chances are if they have anaphylaxis, they have an EpiPen. All right? Unless they're my wife, it's probably in their car down the street. Diabetic, again, if they're combative, confused, just not making any sense whatsoever, call 911. Support them. And here's the big thing, and I'll touch more on this a little bit, but if conscious, alert, able to follow directions, you can offer them something to eat. For example, a candy, okay. But don't give them Diet Cokes. Give them Cokes. They need the sugar. They need the extra sugar. Or fruit juice. Sometimes the nursery may be the best place to go. They got the little apple juices and box things. But that's, again, if they are conscious, they can follow directions, they can swallow, you can offer them something. Here's the big thing. If they go unconscious, don't shove sugar down their mouth. That's going to make things a lot worse. All right? So we go. Here's where we're all kind of in this. The standard first aid stuff. Don't forget, we're bystanders. We are not professionals. I'm going to tell you now, I will not stand up in the middle of an emergency and, everybody back up. Certified flight medic, let me get this done. I'm be like, hey, I know, where's the little boxes that's first aid on? I mean, I'm not going to sit there and, and I don't think any doctor's going to stand there and go, I'm a doctor, everybody back away. No. We're all bystanders, okay? We're just doing the basic things here. One of the biggest things is if you find yourself in a situation where you don't think you can actually do any of this stuff, crowd control is huge. Crowd control is huge. Moving people away, let's all go over to this side, let's all leave the sanctuary, whatever the case, crowd control is huge. Okay? So you want to call 911 at the minimum. Say, Sam, call 911. Don't go, hey, you, call 911. All 9 of them were like, you do it, no, you do it, no, you print them out, call 911. And have them stay with you. Especially the big crowd control, what happens is people are like, oh yeah, I'll call 911, and they walk away. And they're like, well, what's going on? I don't know. They just want me to call 911. Stay right there with them. Have them stay with you so that you can answer questions, they can answer questions. Assess the situation of the person. If they're confused, is it because they're diabetic or is it because something else has happened? Ask them questions and things. Get the AED or find someone to get it. That's one of those things of you, Joe, go get the AED and come back. That sounds stupid, but there's been times where like, go get the AED. They get the AED and they're like, I don't want to go back now. And they'll leave it. It's like, go get the AED and come back. Okay? And then if needed, begin CPR until the AED arrives. So what we're going to talk about here is this new thing called compression-only CPR. Nowadays, a lot of people are not doing mouth-to-mouth, number one. Number two, I worked for a company, a flight team, that we would treat somebody for almost 10 minutes without ever intubating because the human body has oxygen in it. If we can get it pumping and moving around, it's still oxygen. And if we're adding good compressions, we'll talk about it in a second, we can get that suction going to where they actually get air kind of coming in by themselves. We don't have to intubate them and do all this fancy stuff. Electricity and compressions are what saves lives. The faster you get both of them applied, the better the outcomes are. Okay? So that's why it's really important that if you notice they're becoming responsive, do the pulse check, start CPR, get the AED back, and put it on there as fast as you can. Here's the thing, not breathing, guppy breathing. If you ever had a fish out of water and how it sits in, that's not breathing. That is not adequate breath. If my wife had an allergic reaction and she had very shallow, rapid breathing, wasn't doing anything. That's not adequate breathing. Okay. So if it looks like they're guppy breathing stuff, let's start doing some CPR. So what you're gonna do this is where my son was supposed to be here, but really, you're gonna clear everybody out. You're gonna kneel down at their chest level. This is what's gonna become important is you're going to have to take everything off of them, okay? Because when an AED gets there, you want it on bare chest, okay? Bare chest. But you're gonna kneel down beside him. You're gonna extend both your arms and interlock your hands, kind of like this. And you put one to the other. You're gonna put the heel of your hand. There's a sternum notch that on some people you can find. Some people you can't find. So we kind of do nipple line, is what it's called, and it's where they're supposed to be. Okay. So I know I don't know how to say that without saying okay because okay anyway so so you want the middle of the chest, okay? Now you guys will never forget that when it happens. You'll be like that's not what's right. So middle of the chest, okay? You can put that. Where are you playing this at if you're recording it? Because that sounds wrong, man. So put the heel right on the chest bone. Put your shoulders right above your hands. You're going to push, using your body weight, push hard and fast. 100, 120 times a minute. Okay? Have you ever heard the song Staying Alive? Think about it in your head. Staying alive, staying alive. Yeah. Okay? Do that for 2 minutes. Okay. When the AED gets here, you're gonna be like, "Hey, you take over. I'll do the AED." So I'll be honest. I've been in the ambulance singing this song. It keeps you on rhythm. Okay. So here's what's really tough to do, especially if you've never done it before. You're gonna push down on their chest on an adult 2 inches, or half of the chest cavity. So when you push in, you are using your entire body to shove down on. And this is going to sound bad, but you should break ribs. Okay? That's how CPR really is. Okay? You should be pushing hard enough. You should break ribs because you're pushing down so hard. Here's the next thing you have to worry about is let the chest come all the way up. So the heart is like, I should have brought a balloon. You know, if you have a balloon full of water and you squeeze it, if you don't let it fully expand back up, it won't refill. And so the whole point of CPR is to get blood and oxygen moving around. Okay, especially the brain, the heart itself, and then the kidneys really. So if you can compress hard enough, it takes several compressions to get a full cycle around. But if you're not letting the chest come all the way up, that heart's not refilling, you're just squeezing an empty bag. That's all you're doing. So all the way, get down, let it come up, and just keep going, keep going. So this AED will tell you 30 compressions to 2 breaths. Just keep doing compressions. If you feel comfortable doing breath, there's a thing in here you can put over the mouth and all that kind of stuff. What happens is you get doing compressions, you stop compressions to give breaths. Breaths aren't good enough. Now you've wasted time. Now you got to get back up and do about 10 compressions before that heart really fills back up again and gets a good squeeze. So if you just do compressions only, there is not one medic or one doctor or one nurse who's going to tell you you ruined everything. No. Now if you're doing compressions and stop and trying to fix the head and let me do it again, then someone's going to be like, well, what are you doing? Okay? So compression is probably the safest way to go. When the AED arrives, it should come packaged. I'm trying to make them all look something like this. I went to the AED today, and the pads were outside, and then the AED stuff wasn't really attached in. And I can just see somebody grabbing that AED and coming with it, and the pads are still left. So I'm trying to make sure they all look something like this. Okay? The AED that's in the new one that we just got in the sanctuary does not have them in boxes. Okay? Which is actually a pretty good thing. Whoever put it in there went ahead and took them out of the box, which isn't a bad idea. This AED came from the kitchen by the offices, in the office hallway. In that kitchen, that's where this one came from. The other AED is in the back of the sanctuary. Well, depending on how you look at it. The sanctuary back by the Northex. as you come in. It's actually right up against the wall. And if you don't know it's there, you'll walk right past it all the time. All right? So it's right as you come in. It's right there against the wall. It's in a big white box. That one actually has pediatric pads and adult pads. This one, as of right now, only has adult. Okay? So when it gets there, again, if you've been doing CPR, feel free to say, hey, come take over because I'm exhausted, and you get this ready. Okay? If they're like, I ain't doing that, then coach them through this. There should be a bag that comes with it. This bag has trauma shears, has little scissors in it, has some alcohol pads in it. It's got like a towelette kind of thing. Again, if they're profusely sweating, you need to dry that off. Okay? That's what's in here. And I think there's even a razor in here. Okay, for some of the guys. So at this point, once you get this out, it kind of talks you through it. Okay, it's really, really simple. You're just going to pop the top off. Alright, I'm probably like not even looking at this now, but alright. This can actually go underneath the person, behind their shoulder, right by their shoulder blades. So what's going to do is their head's going to kind of hang off and it's going to open up their airway. So when you are doing compressions, you actually have a full airway. What happens when people collapse is they do this and it pinches off that airway. Right? So if you can have it open, unless you're trained how to head tilt, chin lift, and do all this, could probably help you. Okay? And this kind of slides right underneath the back, right on the shoulder blades. I did not open it today because people were there and things, but is that AED, do you have the pads hooked into it? Did we hook those up?
No.
Okay. Alright. So ideally, your pads are going to come already hooked up to this thing. Okay? Because if you don't, when you turn this thing on, it's going to tell you, attach pads, attach pads. And the last thing you want to do is try and do this real fast and cram it in there and break it off. So we're going to try and have it in there so it's going to look kind of like this in there. So, ideally, I'm going to say this, it sounds stupid, I know, but if you were doing this in a medic class, it would make perfect sense. When the AED gets there, turn it on. Okay? I know it's dumb, but some people sit there and go, it's not doing anything.
Charge up.
Turn it on. When you start turning it on, it's going to self-analyze itself. It's going to do this little thing.
Adult pads.
It's already attached to adult pads. So,
Unit okay.
alright, that means I did good on changing the batteries.
Stay calm. Check responsiveness. Call for help.
Okay? Alright, so, I mean, if you pass that point.
For pads to patients for a chest.
Alright, here's the thing. These are like dummy-proof, fireproof. Firefighter-proof. They have pictures on them. Okay? I don't like it all attached to it.
For pads to patients for a chest.
Okay, shut up. Like we heard enough of you. There are pictures. Okay? The blue part goes over their sternum. You want to get it as close as you can to the center of their chest because while you're doing compressions, this is going to tell you if you're going deep enough or going fast enough or going. This is going to give you some feedback to your compressions. And then stretch out your pads. Alright? When you put them on, hold your hand here, take number 2, step 2, and pull it. And then you're going to push from the center all the way out. Make sure it gets a good attach, okay? This again is where your crowd control is great because you're cutting their shirt, you're cutting their bra, you're getting bare chested. And so you want to make a good seal. Same thing on the other side. You're going to hold this side, pull number 3, and just pull that out and then seal it on. Now, if it is a large person or some other situation, there's a perforated line right here. You can actually tear that and it pulls it over a little bit more and you can put it on their side. Okay? And then once you do that, it is going to realize the pads are on and it is going to say analyze. And it's going to tell you don't touch the patient. What this means is don't touch the patient. Let it do its thing. Just stand. I know it's awkward because you've just been doing homo CPR and now it's telling you don't do a thing and you're sitting there going, okay? And it looks really weird, especially to some family members, okay? It's going to analyze. It will tell you if there's a shock needed or not, okay? Without going into much detail about it, if it says no shock advised, start CPR, Okay, basically the heart's in a rhythm that it can't shock. If it says shock advised, it will tell you to make sure everybody's clear. Don't be touching the patient. What we say on the ambulance and things is, I'm clear, you're clear, we're all clear, and then we shock. So the idea is to kind of keep your hands off. There's a flashing button here. It looks like a heart. It will be flashing. Again, this is simple, but in the moment, push the button, let go of the button. Okay? A lot of people say to smash it and sit there and think that the harder they push, the more that it's going to be shocked. No. Once you hit it, let go of it. And it'll say shock delivered. Once it says shock delivered, it's going to tell you to do CPR. Okay? It's going to go to 30 to 2. Okay? 30 compressions, 2 breaths. The idea here is to do 2 minutes of CPR. It will tell you, there's a timer on here. It will tell you all the details you need to know. And it'll tell you analyzing, stay clear. And then you back off, you stop what you're doing, let it analyze. And if it says shock, do the shock thing. If it says no shock, continue CPR. The more people that you can kind of have help with this, a little bit easier it is for you, because it's very tiring to do compressions, and it's very hard. So you will know if you get what's called return of spontaneous circulation. What the medic may come in and go, did you get ROSC? Okay. That's because we're really cool and we can't say anything, so we just synchronize everything to acronyms. Return of spontaneous circulation. You will know. Okay. I had one while I was doing compressions, and he just and reached up and grabbed me like I was beating him or something. So you're gonna know. Okay. They're not gonna be like batting their eyes at you and just, oh, thank you. I mean, they're gonna be mad at you. They're going to be very upset with you, okay, because you just beat them up, really, okay. So you will know, and if they don't, continue what you're doing. Okay, just continue what you're doing. Somebody's on the phone with 911. They'll be here. It seems like forever, but they'll be here. The adult pads, and I put this in here just because this is their terminology. Always use an AED pads for adults if the person's a child under 8 years old or less than 55 pounds. Use the pediatric pads. Hey mom, I know you're freaking out, but how much does he weigh? No. Don't delay using the AED. You can use the adult pads on the kid. Especially with some kids nowadays, they're big enough, they can probably do the whole pad. You can always put one pad here and put one pad in the back. Okay? You kind of sandwich them together. Okay, that's an alternative. But you never want to use pediatric pads on an adult. It doesn't give enough power. Okay? So that's one thing about having just adult pads. We can use it no matter what. The other one, if you grab the pediatric pads and oops, so then you have to do the whole process over again. Disconnect it, reconnect it, put the right ones on. So always use the adult pads. Don't hesitate to use electricity on a child. The large individual females, like I said, you can tear that lower part, put it lower on the left side. Pacemakers, defibrillators, are usually on your left side. So I don't know why this is even mentioned, but the pad goes on the right and the left. Now you can, if you put them backwards, you look kind of crazy because the picture's on there. But in the heat of the moment, you're like, here, and let's go. Okay. What you want to do is don't put the pad on the defibrillator if you happen to do that. Again, when you cut their shirt, you will see. I don't know if you have one or you'll see it. Okay, unless they're large and adipose, you'll see it, you'll feel it, you'll notice it. But you can use the AED with someone who has a defibrillator or a pacemaker. It's okay. All right. But the biggest thing is you want to keep that sensor, that CPR sensor, that blue piece, as close to the center as you can. Okay. Because that's going to be telling you how well you're doing and give you feedback. Here's the thing. So, I kind of jumped through that stuff. Anybody ever used an AED? Okay. Anybody have any questions?
I do.
Yes.
You've got an adult pads hooked up to that. They are connected to that wire.
Yes.
So, okay, so you're telling me to put the straight part on the sternum or right at the breastbone?
Yep.
One pad to the right, and
Yes.
it's kind of right here on my chest.
Yeah.
Now, I'm a little concerned or confused. You say a heavier person, you can put it down further. Where does the pad need to be?
It needs to be
On
as,
the far left, or?
so think of, okay, so where the heart sits, it's going diagonal. So you kind of want them diagonal. So the best place to do it, mid clavicular kind of, that nipple line deal,
Uh-huh.
they go straight down the body as well. That's kind of where you want to put it. So you may have to lift the breast, under the breast, lift the breast, put it right
Okay.
there.
Okay,
If you need to, like I said, it tears away if you had to get it around some more. The idea is it's going to send electricity from this one to this one through the heart.
okay, so that answers my question, I guess. If I had a small child and I had adult pads, I would put one here, but if I tear that away, it still works if
Yes.
I put it in the back.
Yeah.
Even though it's not hooked up through the electrical cord.
There's a wire back here as well. So there's small kid, you'll put one here, you're going to put it here as much as you can.
Right,
This one, you're going to be able to wrap it around the kid.
right.
If he's
Okay.
less than 55,
I can wrap it around.
you got Carly here?
Yeah.
Carly's too big. She's like
Yeah, she's like
60 pounds.
100.
So you can use a big pad on her. The small kid, you're gonna, it's not really gonna fit. It's gonna cover them more.
Right,
You know, so you trying to finesse this pad to fit the little kid's body.
but if I have to tear that second pad,
Yep.
it will still work.
Yeah.
That's.
Now, I mean, it does. It's just perforated. So in the moment, and you yank it, you can pull it out. At that point, you're gonna have to get another set of pads, which there should be 2 with every AED.
Got confused again.
No, there's a wire connected
She's too
to
big,
it.
technically.
And as long as I cut the wire.
Yeah, as long as, but the reason why I'm saying, is I've been in a situation where it's been heated, and at the moment, professional, where I have, and I say this as kindly as I can, I hung the baby off my stethoscope, okay? Just in the heat, I was and I lifted the baby off the stretcher. I mean, so in those moments, I would not be shocked if somebody tears this perforated line and rips that cord out. It would not shock me at all.
As
Okay?
long as the cord stays in contact.
As long as
Yeah,
you
it will
tear it
work.
this way, and remember, it told you to stay calm. But I mean, so
Oh, okay.
that was the first step. No, but really, good question, because really, I can see somebody ripping this out and ripping it apart, by all means.
So is there a little cord that you'll see if you have to go around to the back that you
Yeah.
can see go around with that and you'll know it's intact?
Yeah, that cord is, it's relatively long.
But it'll
It'll come around,
string
yeah.
along with it.
Yeah, it'll come.
Okay.
Okay. You got lucky. I explained the question, I think, maybe.
Times it.
It only hurts once. It's fine. So, but even with her, I mean, if you take this, like I said, how much do you weigh? You're on camera, don't say that. So, what you're gonna do is, this just kind of goes in the center, as much as you can, according to the anatomical lines. But see, it's on the shoulder.
Right.
So I mean, just as close. I mean, just stick it there. No, we're not.
Okay.
This was gonna come and stick kind of right on her side.
Okay.
I mean,
And
you know,
that's okay.
and that's okay. That's okay. Even though she's not very big, I mean, you might be able to do PD pads, but I would, as a daddy, slap them on
Okay.
and get to it. I mean, as long as there's a good seal, as much as you can, you know, as much as, yeah.
I find it odd that they would put it where you position it with the cord going toward the head.
I know. I was kind of, as I was
That's
playing with
wrong.
this, I was like, that's just. But again, if they're laying down and you're right next to them,
Yeah, but it takes away from the length of the cord. I mean, unless
Exactly.
you have it up, right up here by the head.
unless, yeah. So it's, yeah.
So,
I didn't sell it. So.
our question then, where would you position the machine as opposed to where the patient's laying?
Well, if you were, if somebody's kneeling down at the chest, I'd put it right next to them, like that. So that'd be next to their head. So it would be
Okay.
kind of right over their head. You're gonna put it, and as you're doing compression, put this stuff around. Don't stop compressions for them to put it on. You keep doing compressions. Let them
Somebody
dance
else.
around you. And this is where you're going to get very close to somebody. I hope you all love each other, because I mean, you're going to be in their way. You're going to have your sweaty armpits all up in their face. I mean, this is not going to be pretty, okay? So, but you just keep doing compressions. Let them work around you, okay? So at that point, it would be at their head. So I mean, I could see a little bit where their thought was. If this was their head, and you,
Right.
I hate this part. That bugs me. And so you're putting it on their chest. I mean, it's kind of hanging over their shoulder.
Yeah, I have.
I mean, I can see, you know, I don't like it. And then when she thought about the whole kid thing, I mean, I can see somebody ripping it out. You know. So note to self, we need to get another set of pads for this, just in case somebody does rip it out. Okay. So, anything else? Any other questions about the AED before I jump in? Sounds great. We'll get to this in a second. I'll tell you what it records and stuff. The EpiPen. There's two different types of EpiPens nowadays. This is your common one. Okay. When you use this, it comes in a case. Just pull it out. All you're gonna do is take the blue thing off. Okay. Do not put your thumb over this. Because what happens is you get really excited and you go, oh yeah, I'm gonna go. Oh, let me do this, and you go like this, and you stab yourself. So, hold it in your fist, okay? Do not put your thumb over that. But you'll take the blue piece off. You will kind of swing and hit their thigh. You don't have to punch them with it. Just kind of swing, firm hit. It'll click, and then hold it there for 8 seconds. All right? And when you let go of it, the orange piece will come out and will cover the needle. So you don't have to worry about sticking yourself again. Keep this. Don't lose it. Don't throw it away. When the EMS comes, give it to them. And they'll take it to the hospital and stuff, and that's how people get reimbursed for their EpiPens. But of course, if it doesn't work and something happens, they're going to want all the lot numbers and all the stuff off of this thing. So don't just do it and go, okay, trash it. Take it with them, okay? But again, if they have one, they're probably going to do it themselves, okay? Jennifer, when she has these moments, she knows it's coming, and she's going to be, hey, I'm having a deal, and I just look at her and go, well, do it. And she looks at me, she does this, she goes, she hates it, okay? She hates it. The first time we did it, it made her very, very mad. It didn't work as fast as she wanted it to. But
And you do it through the clothing.
you can do it through the clothes, okay? It'll go through jeans, it will go through, okay? They've come out with this new version because, again, medics are dumb and we need to be told what to do. And so,
this trainer contains no needle or drug and is for training purposes only.
It tells you what to
Do
do.
not use this trainer during an allergic emergency.
I got it. Thank you, Sari. It's going to tell you.
Ready to use. Pull that safety guard at least black end against
Pull this off.
then push
Color-coded,
until
black
you
end,
click a
same thing.
sound and hold in place for 2 seconds.
You put it on their thigh, you'll push it,
2.
it'll
1.
hiss, wait a few seconds,
Complete.
and let it go. Okay? What happens is,
May be reused for training purposes.
what happens is,
Prevent safety guard.
what happens is people go, ready? Okay, ready? Okay. And they go like this, and they go, done. All they just spewed all that medicine on the floor. Push it and hold it. And hold it.
So are you saying we have EpiPens too?
No, I'm saying the person will have it themselves.
We'll have one.
Okay? So if somebody's like having wheezing problems, feeling like their throat's closing, their tongue's swelling, are there peanuts in this? That's the first sign, okay? Just go ahead and start calling 911 because they're asking for a reason. They're going to be able to kind of give you some inclination. Jennifer's bad about this. She will leave this in the car. So she's in here having dinner, and let's say she ate something for lunch at school, and 5 hours, her deal comes 5 hours later. Okay? So we're sitting at home 2 o'clock in the morning. She ate dinner at 10 o'clock, and now she's having some episode at 2 o'clock in the morning. Wakes me up every time, annoying. But you can ask them, hey, do you have an EpiPen? Where's it at? They should be up in my purse, bag, In the car, clear across the parking lot, okay? They should have one, okay? If they don't, there's nothing you can do. This is what's bad about there's really
There's no way to
nothing-
help clear their airway or anything until some help
No.
gets there.
No.
We're gonna have to use that AED on you if you keep talking about her in front of us.
I'll take the batteries out.
Do they have these now? I had one once upon a time when I first come up here, when I was by myself, because I didn't go into the shop or anything, but I had a pretty bad reaction to the wall spring. So I got one from my doctor, but it said to keep it cool or cold, and it's only good for so long. Has that technology changed?
Yeah, I mean, there is a shelf life to these, and I think it's several years now. I mean, I don't think 6 months. I think it lasts a while. You do want to keep it cool. I mean, the idea is that when it gets hot and the medicine, it changes the structure, and you want it to be in its ideal condition so it works well. So leaving it in the car doesn't help.
And the expiration date, yeah, it doesn't turn chemically bad.
Exactly.
It's just less effective.
Less effective. So I'm telling, don't sit and go, hold on, ma'am, just be patient.
I'll never
This
see it.
expired by like 2 weeks. Man, all right, here we go. Let's let it happen. Okay. Because I'd rather you give it and it be less effective than sitting there going, well, technically, and they're sitting there dying in front of you, and you're like, it's okay, EMS in the way. Especially out, and you guys know this, out in this area, it's not the city. Man, the city, I could get to a patient, I could start an IV, I could be drawing up epi and we're pulling in the hospital. I mean, and we're so close to, out here you don't have the luxury. You don't even know if EMS is going to be down at the station. They may be clear in Mineola and coming this way. They could be coming from Winsboro, from a call they just got finished in Winsboro and headed this way. So you're looking at miles, so yeah, if it's expired, I don't care. Here, let's get it. All right. Again, we're bystanders. We're not professionals, okay? So even if you did, let's expire. Oh, my bad, so I'm trying to help. Just all right. And then of course give the EpiPen to EMS. Quick things about diabetics real quick. Like I said, if they're awake, alert, able to follow directions. This sounds dumb, but we ask them 4 questions. What's your name? What's your date of birth? Who's the president? Chances are if they laugh at you, or they snicker, or they sit there and look at you with a dead stare, they're alert enough to know who the president is. Okay, so, and then you can ask them where they're at. But ideally, once you get the president, you know whether they're awake and alert or not. Okay? But like I said, give them something sweet to drink, non-diet drink. The youth room's got Cokes all the time. Go grab one of the orange Cokes or something. I think we don't keep juice here.
I do.
Well, you do, but I wasn't gonna point you out. But okay, so
There actually is sometimes in
Okay.
the backpack closet.
okay, so
There's
yeah.
But
there's
now that
some-
door's normally locked, but if you,
But I mean, if we know, hey, you're okay. I know what's going on. I've got a little bit of window here. I can send somebody to get some.
sometimes there's grape juice in the refrigerator.
In the refrigerator.
There you go.
Yes.
And then I said, there's and that's why it's the nursery. They always got a juice box somewhere. But even because they're hires you for cookies, crackers. Again, if they can listen to you, if they can swallow, if they can follow directions, you can give them something to eat here. The onset can be rapid, but recovery can be quick as well. Okay, if it's a sugar-related deal. All right. But here's the kicker. Remember, what goes up has to come down. So just because you look at them and I'm a diabetic, my sugar's getting low, I feel really dizzy, I feel weak, and we can kind of give them some orange juice and stuff. Don't give them the orange juice and go, oh, you sound better, have a good day. No, because what goes up is going to come back down again. Right? They need to get someplace. Low blood sugar is usually a diabetic emergency if they're excessively thirsty. People who have high blood sugars, when we're talking like high blood sugars, I mean, you're looking at 300, 400, 500s on the little scale thing. They don't even test their blood sugar, it'll just say high. Or it shoots this like flashing thing that says, can't read. They're usually thirsty. If they're really thirsty and conscious, just give them water. They don't need sugar. They have too much sugar as it is. Just give them water. So again, these situations, there's not much you can do for them. Really, I mean, you can reassure them, you can help them a little bit, but they need to correct their sugars. And then here's the big thing. You have done successfully CPR, done your job, all this kind of stuff. EMS finally shows up, and the first thing you're going to do is go, finally, right? And then they're going to start right where you left off. Okay? I went down and I drove to UT Health and asked them a couple weeks ago, I said, look, if we had a situation, I told them where we were. There's a Methodist church right here. If we had a situation where we had to use an AED and CPR and stuff, what does your protocol say needs to happen? Like, what should we expect? And here's the thing. One thing that I liked about EMS was it's all medic driven, okay? Meaning, I get to make all the decisions. So if I'm the lead medic, I can show up, and if you're doing CPR, I can sit there and do CPR in your sanctuary for 30 minutes and then call it right there and be done. And then we sit and wait for the ME to show up, or the judge. Okay? Even the hospital's right there. I can work it right here. It's what we call stay and play. I can stay and play here and do all this stuff in your sanctuary floor and never move anybody. Okay? So don't think EMS gets here, they're going to put them on a stretcher, they're going to throw them in the ambulance, they're going to take off, and maybe not. They may decide to stick around. So in that situation, don't be so pushy. Get them out. Oh, why aren't y'all doing something? Why aren't y'all doing that? It's okay. They're doing their thing. They're going to ask you, how long has the person been down? Now, you probably told dispatch this. Here's the issue with EMS and dispatch is slow. I probably shouldn't say that just because you put something. Dispatch is typing away, okay? The communication between the dispatch center and your ambulance going 70 miles down the road isn't as quick. And there's times that they're going to ask you the same questions you just told dispatch, okay? Just answer the question. How long have you been down? How many shocks have been delivered? This AED keeps track of that for you. On that screen, once you turn it on, it will have on there how many shocks you've given. Okay? It will actually tell you how long they have been down from the time you turn this on. Okay? So if it's been 5 minutes before that, you're like, oh, this says 10, it was probably about 15, Tell them, hey, we've just been doing compression only for the past 14 minutes. That makes a big difference if they're going to intubate in the field or if they're going to think, hey, I can make it to the hospital and all this kind of stuff. Everything that ER does over there, you can do in the back of an ambulance. Okay? So if you've been doing compression only CPR, that person's been without oxygen for 15 minutes. Maybe we need to consider the idea of getting oxygen started. And we'll do it right on the floor. We'll make it work. And then how has the person responded since you've intervened? If they're diabetic and you said, hey, I gave them this orange juice, they drink about half of it, they got a little bit better, but I've kind of noticed it's been a little bit harder to keep them looking at me and waking up and stuff. Okay, well, that was obviously working, so we know what the issue is. I'll give you some medication, the ambulance will be good. I gave them this stuff and they looked at me like it didn't work and didn't do anything. Maybe there's something else going on. Like I said, be prepared for them to stay and play. Despite where UT equipment is, interventions can be initiated prior to loading. Here's the deal: CPR, and this is what's really tough, especially for people and say in society and the community to understand, is I can drive. I don't know if you guys have a reference to this. Anybody know where Mesquite is?
Yeah.
Mesquite,
Yeah.
Texas. Okay,
Yeah.
take Mesquite. Do you know where Baylor, Dallas is?
Yeah.
Okay. We can get there in 12 minutes running lights and sirens. That's kind of hauling it, okay? That's 95 miles an hour or whatever. We can get there in 12 minutes if we have to. However, you think about the traffic and all that stuff. Your compressions that were really good right here, we stopped doing compressions to pick them up and put them on the stretcher. Then we're doing compressions. Then we have the electronic, and it raises the stretcher. So, short like me, you're going this and then you're doing this. You're not compressing with anything. Then you're walking while you do it. Okay. Then you put it in the ambulance. You got to stop while you put it in the ambulance. Then you get up there. Then you start doing compressions again. And now he flies out of here and hits the curb on the corner right here, which is now throwing me off. And now I'm back doing compression. By the time I get to the hospital, the patient has been gone, 4 or 5 minutes with no compressions whatsoever. Versus we can stay here and get really good compressions here and maybe get the person back before we ever move them. Okay? So, don't think just because EMS arrives is all over and done with. You guys still can help out. And so, Any questions? I just threw a whole bunch of stuff and things. Here's the deal. This is in the kitchen by the office. The other one is as you come into the sanctuary, right as you come in the door, it's right there on the side.
Between the double door with the ramp and the door with the stair.
And there's a sign outside the.
There is a sign, yes, there is a sign. Again, the big thing, if you're not comfortable, I'm telling you, it's, oh yeah, no problem, not a big deal. You get doing it and find out that I can't push hard enough, I can't, grab somebody else and say, hey, would you help me? Hey, would you, again, at the end of the day, we're trying to help. We're not professionals, we're not, so if you've never done it before, it's kind of, it's tough. It's very, very tough. Giving the epi for the first time. You hope it works, because this one's gonna save your life. Here we go. And she does. She gets it, and I'll make her lay there as long as I can possibly get her to lay there. But she's so anxious and so nervous that she'll try and get up, and when she gets up, she hits the floor, and then, So it's very, very nerve-wracking during those few minutes till EMS gets there.
Should we stock a couple of EpiPens?
I don't know if you can get EpiPens to stock.
Do you have to have
Write a prescription for it.
You do have to
Yeah.
have one?
Yeah.
Prescription.
And they're pricey.
And they can be pricey. I mean, they can be. I mean, unless you had somebody on your, I say, security team or that would be able to do that. But if it's just bystander, I don't think we can get it.
And there's supposedly different dosages of EpiPens.
I mean, yeah, PD dose and adult
yeah.
dose, and I mean, so. And I think to some degree that probably end up leaving you up in this liability. Now you're trying to play pharmacist at that point.
I know when we made our next to last trip to Africa, we did have an RN with us, and she brought, 2 or 3 EpiPens, just in case of an emergency, and that we did have one emergency along the way, and it really did come in.
Absolutely. I mean, like I said, we may have, you could probably step through some hoops to get one, but again, get one and somebody's being combative and like, oh, they're having a reaction and hits them with epi and they're having a diabetic emergency. Now it's like, oh, well, why'd you even have that? How'd you get that? Where'd you get it from? Oh, you're licensed to give that? Oh, what? And I think you really kind of opened up a big deal. For a bystander to do that. Because epinephrine is what we also give in cardiac arrest. It's a higher dose, but so when you give that epi, don't listen to my wife. She will tell you, do not call 911. She'll tell you that. She'll tell you, and guess what? We have called 911, and I've gone out to the ambulance, and I've said, hey, chances are she's not going to go with you guys. But would you please come in here and because if it takes them 15 minutes to get to our house. Right. So after I've given it to him, she's done 15 minutes. If she's going to have another reaction, it's going to happen, in this window and stuff. I'd rather them be there than me going, oh, well, no big deal, don't show up. And now I have to hit her again with a nut. And now she has no, and we have an agreement. If she takes 2 epis, she's going no matter what. That's not the question. But, so she'll tell you don't call them. But if they get epinephrine, they need to go to the hospital. Just because the after effects can be cardiac related.
And the emergency services out here so far, they'll come and take your blood pressure and kind of look at you and stuff, and they do not charge you unless they take you. Like Dallas, when they come out, they're going to charge you whether they take you or not. Yeah. Out here, they do not charge unless they transport.
So even if somebody is having this, I feel dizzy, I feel weak, I ate some hot sauce and Mike's the other day and I just don't, but really, it's not just indigestion, they're actually having a hard day. It's okay to call EMS out and it's okay for them to be checked out and they can say no. They can always say, hey, I'm good, I'm fine, I'll drive myself, no big deal. Again, older populations, they don't want to be a nuisance, they don't want to be a burden. Some of them are fixed income, they can't afford the ambulance ride. So some of them may say, I'll just do it myself. I'll just go over here. So, but it's okay for them to come out. They'd rather you come out than not, so.
Well, and the EpiPens, sometimes for a while, they were given double doses when a doctor would write a script. You could
Yeah.
You could get 2 doses. You know, there are times when you need to do it
You
twice.
have to do it twice.
And the Huffman has to use.
And that's what I've,
Yeah, one time you may think, oh, got it, we're all good,
Exactly.
and the person's not out of the woods yet, so you do have to do that.
exactly. So, in fact, it comes in a bundle of 2. There's 2 of these that kind of stick together. And then I think there's
a 2-pack.
a 2-pack for these as well. But yeah, I mean, you can give it, and while you're waiting and medics get there, you may have to do another one again. But that's, usually you give it to them, you wait 15 minutes. If they're not getting, I was doing sternal rubs on her one day, and she looked like a dead fish. She was just flopping. I mean, the next day she was like, man, my chest hurts. And I was like, I'm out. I don't know. But, and I'll be honest, I was sternal rubbing, and I was like, look at me. And she told me, she goes, you're getting black. Like, you're not, like, I can't see you. And I was like, hey, and come on, and of course my daughter's standing right there, so now I'm starting to freak out, thinking this is going to be it. Like, this is fixing to happen. And she was just, and so you'll know, and after that we got EpiPens, but you'll know, okay, if you give the EpiPen, they're like, yeah, I'm okay, boom, and head down again, you might want to do it again. I mean,
Do you have any family video of that you could show us?
actually, I know,
She'll kill you.
oh yes,
You need stroke.
well, they're recording this, so I can't say too much, but no,
I can make coffee just
so like I said, I mean, when it comes to these emergencies, you're gonna know something needs to happen. Yeah, I can walk into somebody's house and know we're gonna stay and play, load and go, but we ain't going anywhere. Just from walking into the house. A nurse can do the same thing. They can walk into the ER room and look at you, and they know this is legit, something's really going on. We'll have to figure this one out a little bit. Alright, so when these things happen, you're going to know something needs to happen. So don't hesitate to call 911. What's the worst thing? They come out and go, they just ran a marathon. That's why they're sweaty. It's okay. Calm down. Right? But you may have to ask some questions and get some details of things. So
back to the compression.
Yes, sir.
How do you know if you're not using enough force?
well, if you have this machine on, it tells you.
Yeah.
Push harder, deeper, perhaps. You're gonna, cause when you start doing it, you're gonna get a good 10 really good, and then you can start doing this thing. When your elbows start bending, you're not doing very good. Ideally, like I said, it's about half the size of the chest. So I mean, you're talking a good hard push.
But if the chest don't come back up, you didn't give it enough compression, right?
Hey, it's gonna come up. I mean, I can push
Just
push
better-
myself and
right.
it'll come back up. But you'll, because when you push it and then you kind of come back up again, you won't leave the chest, but you'll feel it kind of recoil back. It's the recoil you want to come back, and you'll feel that.
And it's not, excuse me.
No, go ahead.
It's not as adequate if you are not exactly on
I mean,
top.
you're
I mean,
yeah. This whole,
Yeah.
Grey's Anatomy. Yeah. Oh yeah. Go ahead and get that real quick. You'll be fine. Yeah. No. I mean, it's like pushing the table. I mean, trying to break the table. I mean, you should be pushing that hard.
You're gonna break ribs, and that's why they have to go to the hospital. I mean, that's
If
just
you
what's
let
gonna
over
happen.
people, you're gonna break your ribs.
You should break your ribs on Joe. I mean, you should be pushing that hard.
I'd say something about crowd control.
Huh?
Is the fact that that's a problem that we had a lot. People rubbernecking.
Yep.
Like since at this church, everybody get to the side.
Yeah.
And have somebody out front to direct that ambulance to which door
where
to
they're
go
going.
into, because that's seconds left.
Exactly. So I would assume, just from the way we sit now, is if something happened, Mike's going to be the first one to see it. Mike's going to see him sitting there rocking back and forth. He's going to be the first one to notice something's up. You're not sleeping or whatever.
It's happened multiple times.
Okay, and so he should kind of stop what he's doing, I mean, at that point, and hey, we need to help so-and-so, or hey, and he may call out, hey, Daryl, come help, you know, and call him out by name, and then he can kind of help direct and guide some, hey, let's go ahead and just, however he
Even
wants to do
opening
that.
doors for them would help, you know, just, because you know where they're coming in, and they're coming in fast.
Exactly,
So just get the hallway
Um,
cleared and get them.
And that may be something with our ushers that needs to be mentioned is, hey, if you're ushering for that day, something happens, somebody needs to be outside, because they may come from Brookshire's on this street.
Right.
And then there's something going, I don't know where to go. They may come along here. I don't know where to go. So we need to have somebody on the corner saying, hey, this way, this way. But again, we don't need somebody down here at Joy Hall saying, hey, come here. And somebody at that corner going, come here. A little bit more directions and stuff like that. So.
Who is responsible for checking the batteries and how often are they checked?
So this was checked
Uh-oh.
April 30th of 2018.
Oh, wow.
I changed the batteries on June 8th of 2020. So we need to check it a little bit faster than just 2 years. Okay, so really, you know, every 30 days, it does a self-check itself, but I noticed this one was beeping, you know. Yeah, like what? We thought it was Sam's phone, or we thought it was like a computer or something. So we're just like, okay, whatever, it's beeping, okay. But as it dawned on me, I was like, wait a minute, hold on, let's go look at this thing. And then sure enough, the batteries were dead.
Dr.
You know.
Waddleton checked this on a fairly regular basis.
So, and I knew there was somebody else who did that as well.
But, so she's not doing it anymore?
I said checked, the last time, it was about 2 years ago, whatever that sticker is.
Yeah.
We got those pads is the last time I know of she checked it.
So I mean, it needs to be checked monthly, basically.
I think so too,
Monthly,
and I think
just to
somebody
kinda-
needs to be assigned to check the batteries.
The Bell Choir Director.
Very good solution, Sam. Very good solution. Very good.
I second that.
All right, we're done. Got a second again. You're right. Especially, I mean, that could be. I won't say that could be anybody, but before I say that, I want to put myself out there and stuff. Yeah, I mean, just once a month, especially somebody who's here all the time. That's gonna be the big
Yeah,
one.
it should be somebody on staff.
So I mean,
Well, we
we
could, I mean, you know, trustees have, like, air conditioning, batteries.
Yeah, if you guys have something, yeah,
so
just-
I think that is on our
that.
To
list.
the list.
But I just don't know how long, the periodicity, how
I don't
often.
either.
I think we, on our trustee list, I think every 6 months, but I don't know if we need to do it more often or not.
I mean, it does a self-analysis, I want to say once a month at least.
I mean,
But again, if it's self-analysis, that's great, but if nobody goes and checks it,
Right.
it's sat on the X for a long time.
It didn't start beeping until 2 years after the batteries were changed.
I mean, yeah.
6 months should be.
I mean, I would think that, initially, yeah. And just looking at, leaving it over, it's got a green check mark here, cool. But it's when the beeping and stuff, I went and looked, it had a red X on it, and I hit the power button and it was like, stay calm, change batteries. It's a little late, it's
Do
not
we
all
have-
here.
Do we have batteries?
We had to buy them.
Oh, yeah, okay.
Yeah.
What do they take?
The 123 lithium, they're about yay big,
okay.
camera batteries,
So we
basically.
probably need to supply some of that. too.
We could get some and just have some in the battery closet and things. I just know when I went and bought them this last time, I just did it just so we had one that worked. So,
They're like $30 batteries.
yeah, I mean, but again, we could have some so that if it, now ideally they shouldn't die, but if you have to use the AED, you want to change batteries. Because it's gonna suck that battery juice down to give that shock. So we'll have to change it after that.
How long does it take for that one to charge up, to
Yep.
get charged? And then how long does it take it to recharge?
So it's gonna recharge. So the shock version, on the at the hospitals you have the life packs. It's like charging, and zzz, and you're sitting there. Come on, this won't do that. It'll start flashing shock, and then you hit the shock, and then once you let go, it'll say shock delivered. It'll start recharging itself. That whole 2-minute cycle that you're doing CPR for.
Oh, okay.
So I mean, you won't be able to give it another shot probably until 2 minutes. It's gonna keep it all time,
Uh-huh.
you know, incremented out and stuff. But it's not like the life packs where you have to hit charge and then wait, and then, you know, so. Yeah. And we should have some first aid kits that go along with this stuff, but I mean, there's really nothing in first aid that we're going to give in these situations, unless unless the dispatch tells you to go and give them aspirin. That'd be the only thing I would consider making sure we had standby somewhere chewable aspirins. But now you're talking about grabbing this and something else to have a few little things in it, but.
And we do have first aid kits in the kitchen here, in the office area, and also in the sanctuary where the acolyte, the changing room, the acolyte. There's a sign outside that room.
Yeah, there's a sign that one. I saw that
Cross,
one.
I think.
Yeah, green, yeah.
And then we have first aid in this kitchen too.
Not really.
Yeah, there's a first aid in this kitchen.
It's a first aid location in this kitchen that I think has been picked through a little
Right, it needs to be
bit. Like the
restocked.
youth room, we've got one too, but it's kind of been.
Well, that's one thing we did at the plant every year, come hurricane duty, we went through the first aid kits, and most stuff got changed out once a year, and there's stuff in the first aid kit needs to be gone through.
Well, I was looking at taking one to camp with me, and I was looking at it. I mean, things were expired by a couple decades, so threw that away. But
You did those monthly?
anything else? Any other questions, concerns, comments, thoughts?
Thank you. Good
Okay.
Yeah, good class.
Good job.
There you go. Check in the mail, please.
I have a question, it may not relate here, but most of our accidents, we have a similar unit in our homeowners association, and we have oxygen as well. But almost all of our emergencies are snake bites.
Okay.
It seems like they come in. What different do you do with the snake bite in terms of
So,
that
the
immediate-
first-
the ambulance gets there?
The first thing everybody wants to, don't cut it open and suck it out, okay? Don't do that. The first thing people want to do is because it hurts, they want to put ice on it. Ice puts the venom back in its natural state, which makes it even worse. So, leave it below the heart if you can. Don't, if it's the arm, keep the arm down. Don't raise it, because you just let gravity do half the work for you. If it is something that seems to be moving fast, I mean, you can see it. You'll be able to kind of see the skin's getting irritated. The histamines are doing their thing. You'll start noticing the redness, the heat. Take a belt, tourniquet the spot. If it's moving that quick, if you're waiting 30 minutes or something, you may want to tourniquet that. Don't chase the snake down. You bring a snake on my ambulance, I'm going to kick you and the snake out, okay? I'm sorry, okay? It was a snake, got it, cool. Don't care what it was. So the big thing is don't put ice on it, and then let gravity work for you, not against you. Don't raise it above the heart. Don't really, and even bites, dog bites. They're not really going to even sew those up. They're going to leave them open. They don't want that bacteria getting trapped in there. So go get checked out, but don't feel like you have to.
It would be easier for a snake bite to just take the person straight to the emergency room.
It could be, but here's the question though, and here's the big question, especially out here. I didn't work enough out here to know very much, but who has anti-venom?
I think the hospital does.
Well, which one? I mean, because you got level 4, and then you have level 1. So they may have something. The ambulance is going to have nothing. They're not going to have anything. But and some hospitals may not have any anti-venom. They may tell them, hey, you got to go to Tyler for that, and they'll ship them to Tyler and stuff.
The last one they had to fly to Tyler. I know.
There you go. I'll be honest.
The best coming to this one since it's a helicopter.
Yeah, that would be my answer. I would go where there's access to something else if we had to. In the city, when we did have a bite, we almost took him to the zoo because the zoo has anti-venom. But Baylor Dallas had some stuff, and the Parkland had some. But yeah, we almost considered taking him to the zoo. So, and the zoo's in Tyler, so just head that way. But the flight crew may even have anti-venom. I don't know what they actually have on the board.
I would think that the fact that it's the oncoming of a problem, and close as the hospital is, and how far the ambulances are stretched out, it wouldn't hurt to just, if they're stable, just get them over to the hospital.
Yeah, I mean, if they're stable, I mean, yeah, if you know, even, and I'll be honest, even if, I mean, if you're calling and they're like, okay, ambulance on the way, like where? Like,
Yeah.
oh, it's going from Lindale, I have to go, forget this.
Yeah.
I'll just chunk in the back of my truck and let's go. I mean, especially this close.
Yeah.
But, I mean, that may be some, I mean, you kind of, you know, do the best you can. I mean,
Are you talking about in any circumstance?
I mean, if I was sitting here having to do, I mean, CPR for 45 minutes, I mean, there's a better chance, there's more, especially if it was here.
Yeah.
That's an idea, but really, you're taking a big risk on yourself to make that call. I mean, that's
Because like you said, when you're moving that CPR
Right,
patient, then you're losing the compressions.
Compression.
you know,
But the epi thing.
but hopefully you
they're
wouldn't be there
taking
that long. Hopefully they'd have something nearby. Well, the fire department has a medic, and he could come over and at least help. He could intubate. He could do some other things. Start IVs. He can do some things. No, they can't do that. Okay, scratch all of that. Yeah, I mean, just so they just have cool lights. I guess that's all they have, right? No. Man, I figured they'd be able to do something, at least, especially with the ambulances that could be possibly stretched out here. I know UT Health does system status management, so they move the ambulances around based on what the calls are kind of at and things. And there's an ambulance that sits down on 37 in between Mineola equipment and sits back in the woods. So when this place gets a call, they come rolling into it. So yeah, you may get a call from Winsboro and you're waiting 20 minutes for ambulance to get here.
The CPR patient, I would leave here.
Yeah.
If it's an epi and they're just not coming on time and they're going into a second EpiPen, just take them in your car.
Well, you
If
can
it's
probably
like
get 'em over
15
there fast
minutes
enough,
and they're
but-
not coming anytime soon and you've shot that second one, drive them.
I mean, yeah, I mean, because at that point you're out. If they need a third one, you can't do nothing. And so it's either watch it happen or try and assist them to the hospital. At least something can be done. So
You can always tell 911, I'm passing by this street. Y'all
if
can
they want to
chase
come
me
chase you
down.
down, but so.
With it getting so hot now, what about heat stroke?
Oh, absolutely.
I mean, don't people confuse that with another condition?
Well, yeah, especially when they're sweating
Right.
and they're walking the parking lot. It's like, man, it's hot out here today. Man.
Kind of, we were testing everybody for COVID, the temperature.
Actually, yeah, hold on. Yeah, by the time you got here, I'm no, you're right. You know, it comes in. I want to say it comes in like, I don't want to say phases. Take James, who just went running. You know, he's gonna get heat cramps. He's gonna get excessive sweating. Then he's gonna stop sweating, and that's when it gets like, okay, that's an important issue. If I'm picking on Mike, but if Mike's out doing the food distribution and Wednesday and it's 90 degrees outside and he's like, man, I don't know what your problem is, man. I'm dry as can be. Something's up. You should be sweating. You should be sweating.
Don't worry, I will be.
That's what I'm saying. Normally, you know, he's like in his own kiddie pool. No, but he normally does. And so if I pull up at 11 o'clock and he's like, man, I don't know what the problem is. You know, that's not normal for you. And so be mindful of that. The biggest thing is get him to a cool area. If you have to, if we're out at VBS and the kid's running around like crazy and he's just red as can be and breathing heavy and not sweating anymore. You saw him sweat when we got out there. Now he's not anymore. Let's get him inside. And he's still panting like a dog. It's still hot and still wet some washcloth. Start putting that around his neck. Start putting it, you know, over his head. Start putting try and kind of cool him down and things. They're gonna start throwing up. They're gonna but you should see. You know, kind of the cramping thing, kind of.
And I think we need somebody else to do recreation now.
I forgot to tell you guys, that's the week after camp. I'm taking that week off. I put that out there now. No, but yeah, you know, so heat cramps. Like like I said, when they stop sweating is your big indicator that something more serious is going on. Get them cool, get them inside cool, and just kind of watch them. Watch them. That's really all we can do.
We were always taught if their face is red, raise the head. If the face is pale, raise the tail.
Raise your feet. I don't know how you raise them. I mean, you can probably raise the feet.
Tell you what,
hang them up.
If it wouldn't hurt, it's a process of defibrillation or whatever not going on. Get as much information as you can
Absolutely.
from them regarding what medicines you're on, what's your blood pressure, you got blood pressure problems,
Yeah.
or whatever. That way you can report it to the ambulance or whether the hospital when you get
Yeah,
there.
if you can ask questions, and especially if they're having a heart attack, because there's nothing you can do. We can give nitro, we can give aspirin, but a bystander's not going to be able to do a lot. And just, hey, has it ever happened to you before? Well, yeah, 2 months ago I had. Okay, cool, all right, good. What did they do then? Oh, we had to go do, cath lab. Okay, good. Because what that does is when you get information like that, and then some of the medications and some of the history and so, that tells the medic where to go off the bat.
Right.
I mean, if this has happened. Well, the lady I talked to that was here, come to find out, she has severe COPD and CHF, and she's been intubated before. And so in my head, I'm thinking, if you're breathing this hard, you've been intubated before. Let's find a chair. Let's sit down and see how things. Calm me down a little bit. Okay, we're. So asking some of those questions can give you a lot of information. So. And some of this stuff is just supportive. Jennifer can chew some gum, and she'll start having a reaction. She can take a little bit of Benadryl, and that seems to subside it when she doesn't want to be honest with me, and does things behind my back. But anyways, so she can take some Benadryl. That can help. But if I'm sitting there and she's like, "Hey, I'm having an episode," and it's like, "Take some Benadryl." I already did. Okay, well, go ahead. Let's get to it. So ask some questions. Definitely give a lot of information, a lot of guidance.
If one of the kids were out playing and got stung by a wasp or something, would there be a liability on us if we had some Benadryl on hand to give them?
No.
I wouldn't think so.
Do you want them to put ice on that?
As the Good Samaritan and Mama Common Sense, no.
We were told over the counter is okay, any prescription.
But here's the deal, as soon
I'm
as,
just talking about Benadryl. over the
yeah,
counter.
as soon as I come, I'm a medic, take this, I take the risk of what happens.
Right.
But if I say, hey, on the first day we have some Benadryl, let's go ahead and give that to them. But as soon as somebody comes out and claims their credentials, you open yourself to a huge liability then.
Well, I'll have to tell you, I had one of my girls, when she was 3 or 4 years old, she was out at the nursery school playing. There was a big tree, and an asp fell on her on her little dress, and she put her hand down there, and it bit her on her leg. And I mean, the red streak started almost immediately. She has allergic reactions, but what they did, and the doctor told me they saved her life. They put Clorox on that place. And they didn't call the ambulance, they called me, but by the time I got her, I know, they got her to the doctor, but, I mean, there are some things, that's why I'm thinking Benadryl or something, in case they do have a reaction.
I mean, to be honest, we learned in school for jellyfish stings to pour baking soda on them. Like, we carried baking soda in the ambulance, but it's one of those things, for whatever reason, it works.
Well, if we had Benadryl or something kind of handy in case.
I would, if anything, I would consider liquid Benadryl.
Right, that's what I'm talking about, yeah.
And so that's gonna be a child version.
Right.
So then you gotta figure out if it's 12.5 milligrams or 5 mLs, then you gotta, you do all the math. But I'd rather try something than do nothing.
Yeah.
Especially under Good Samaritan. I mean,
I don't like compressions. They say it's better to do something than
do something. Yeah. I mean, I'll be honest. I was in the ambulance and punched a guy in the chest because I was like, oh my gosh.
Would kerosene work over chlorine? They used to be the old days. They used kerosene.
Kerosene? I said, do something.
Really old days.
Yes, ma'am.
It came up in trustees though, we have these first aid kits and we're gonna be really careful not to have any medications in there because they're not locked.
Fair enough.
So can
Yeah.
we-
I mean,
where do we keep the Benadryl or where do we keep the aspirin?
And then at that point, who's gonna
Yeah.
Who's gonna be willing to take on the possibility of risk of giving it out? You
Or
know,
someone getting it that shouldn't have it.
so I mean, yeah, what's the worst gonna happen? You give it to somebody, they don't need it, they're just gonna get drowsy.
Yeah, so, by the way.
Which I mean, yeah, but again, I mean, and again, that whole thing, I don't think, again, under Good Samaritan, I think you'll be fine, however you do it. But as soon as you start claiming, I'm a doctor, take this, I'm a nurse, I'm a medic, you're opening yourself up. Because especially on the street, if I pull up on a car wreck, sounds great, I know first aid, that's all I know. And if the guy decides, and if a lady drives up and goes, well, I'm a nurse, sounds good, you're in charge. Doctor pulls up, I'm a doctor, sounds great, you're in charge. And they move the patient, and comes to injure their neck, or he's the one who said, I just know first aid, that's all I know. You can't hold me liable, dude. That sounds really bad, but in today's world, it's kind of the thought process. So, again, doing something is going to be better than nothing. And again, remember, we're bystanders. If you're like, hey, I called 911, I know Benadryl helps, I gave some Benadryl. Nobody's going to be like, no doctor's going to look at you and be like, well, you killed him. No.
So, talking back to compressions,
Yep.
The fun fact of how often people vomit when you do compressions.
Okay, yeah.
In your experience, is it more often than not? I mean,
It
to
is.
prepare people so that they know.
It is. So when you're doing compressions, and again, if you do them right, what happens is as you push down the chest, everything's got to go somewhere, okay? So the stomach goes up, stomach comes down. If you get really good compressions, you can create that suction to get air that comes in. Air can only go two places, the esophagus or the airway. Chances are the esophagus is bigger, there's no epiglottis, it's going to go to the esophagus. The more you do it, the more pressure builds up, pressure's got to go somewhere.
Turn to the side.
And it's going to be coming all over you. And that's why a lot of the mouth-to-mouth stuff, nope, not. Right? And that's why, if you, in all honesty, and this is what kind of is annoying sometimes on the ambulance, we're supposed to have gloves, goggles, face shield, all this stuff before we do this kind of, because of you're at the head, you're getting ready to intubate, and they vomit all over you, and you don't have your glasses on or don't have your face shield on, and then you start claiming, hey, I got vomit in my mouth, and what if they have something, and your company's going to look at you and go, well, did you have PPE on? Did you have the face shield? No, well, sounds like a problem.
And they do have those masks that are.
They do, and I think there's actually one in here.
Yeah.
But again, if you put that on and then held tilt chin lift and get it just right to get that good breath in, it's hard for people that are trained to do it. Especially if you got a little mouthpiece, like we'll take one with us on trips and things. But even those, to get a good seal, it's really, really hard to do. And if you're trying to hold their head up, force this mask down the face, get a breath, and
Work around the vomit, right?
yeah, we're gonna, and then facial hair like Mike, trying to get that seal on his, it's people spend too much time trying to get the head tilt, and just forget it. Let's just compress. And again, perfect world, EMS is right on the road. They'll be here in 6 minutes. Perfect world. So. Other than anything else? Any other questions, comments?
Thank you.
No problem.
Absolutely.
No problem. Now, do me a favor. If something happens, do not stand up and look at me. Okay? You guys know how to do it now. You're on your own.